My name is Justin Lightburn, and I'm an interventional radiologist here at Goshen Hospital. Uterine fibroids are tumors that grow in the smooth muscle or the wall of the uterus. We call them leiomyomas. They are benign tumors, so they're non-cancerous, but they do often cause issues with dysfunctional uterine bleeding. The symptoms of uterine fibroids are usually persistent bleeding after menstruation, pelvic pain and pressure, and then frequent urination due to the fibroids pressing on the bladder. So usually the first thing the patient's going to do is go see the OB-GYN. So they're going to direct them to different pathways in terms of therapy. One pathway is medication, so hormonal control, and then if that fails, then the other thought is an intervention of some sort. So usually it's a surgical resection of the tumor itself, which they call a myomectomy, or a resection of the entire uterus, which is called a hysterectomy. Often, if the patient is not interested in a surgical intervention, the OB-GYN will often refer the patient to us, interventional radiology. So I would treat uterine fibroids through a procedure called the uterine fibroid embolization or uterine artery embolization. So almost anyone's a candidate for uterine fibroid embolization. The only patients that would not be are patients that are seeking to have children in the future, or patients that the tumors are seen to be precancerous or cancerous. Then those individuals wouldn't be able to have it. But outside of those two groups, everyone else is a candidate. The way we do this procedure is usually going into a vessel in either the wrist or in the groin. Everything is done under moderate sedation, so medication going through the IV that helps our patients feel comfortable and relaxed when they do it. Once we put the catheters in, we take pictures using a contrast agent that will give us an idea of where the vessels are coming off that feed the uterus. Once we find the uterine vessels, we'll select those with another catheter and then inject tiny beads that will block off flow to the uterus. And as we do that, we can usually see where the fibroids are and where they're growing. And then after the post-procedure, the patient will be admitted overnight. Often the pain in the first 24 hours may require an epidural to be placed. After the first 24 hours, then we'll evaluate the patient and see how they're doing and usually discharge them home. After that, it takes about 1 to 2 weeks for the patient to return to normal and then get back to their normal activities. During that time, the fibroids will be starved of blood flow and they will continue to die over a period of a few weeks. So typically after uterine fibroid embolization, the symptoms of uterine bleeding will usually stop due to shrinkage of the fibroid. The symptoms of pressure or pain in the pelvis also will usually stop after the fibroid is shrinking. The symptom of frequent urination will also often decrease as the fibroid shrinks and there's less pressure on the urinary bladder. Yeah, if you're suffering from the symptoms of uterine fibroids, which are bleeding and pressure and pain, I would advise that you seek your physician, initially an OB-GYN, and talk to them about the different options that they have, and also consider speaking to an interventional radiologist and getting their take on whether you're a candidate for embolization as a possible procedure.